Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. In last video, we have already discussed the concept of needle stick injury. For review, you can go through it. The link is given in the description box. In this video, we will learn about the prevention of needle stick injury. And we will see some examples of safety engineered devices which can reduce the chance of needle stick injury. And the video related to the do's and don'ts to prevent needle stick injury is already uploaded. Please go through it after watching this video. Link is given in the description box. At first, we will discuss the prevention of needle stick injury as a whole. Ensure that the equipment necessary for performing a procedure is available within arm's reach. Assess the work environment for adequate lighting and space to perform the procedure. Organize the sharps in a way so that the sharp is always pointed away from the operator. And identify the location of the sharp's disposal container. Next, if the sharp is reusable, determine in advance where it will be placed for safe handling after use. Avoid recapping of needles. If needed, use one-handed method. If the patient is uncooperative, combative or confused, ask for assistance. Do not hand pass exposed sharps from one person to another. Use a predetermined neutral zone or tray for placing and retrieving used sharps. If using a safety device, activate a safety features as the procedure is being completed. Getting a hepatitis B vaccination before clinical exposure. This is for all healthcare professionals. And participate in-service education program regarding needle stick injury and its prevention. Let's see the preventive measures during cleanup following a procedure. Visually inspect procedure trays and patient environment for waste materials after completing a procedure. Transport the sharps in a closed container to the washing area or to the disposal area. Next, the preventive measures during disposal. A puncture-proof container should not be filled more than 3/4. Make sure the sharps container being used is large enough to accommodate the entire device. Avoid bringing the hands close to the opening of a sharp container. Never place hands or fingers into a container to facilitate disposal of a device. Keep the hands behind the sharp tip when disposing the device. Let's see the preventive measures after disposal. Visually inspect sharps container for evidence of overfilling before removal. If a sharp container is overfilled, obtain a new container and use forceps or tongs to remove protruding devices and place them in the new container. Keep filled sharps container locked and awaiting for final disposal in a secure area. If any improperly disposed sharp is encountered in the work environment, then how you will manage? Handle the device carefully by keeping the hands behind the sharp at all times and use a mechanical device like forceps or tweezer to pick up the sharps. To reduce needle stick injury, nowadays hospitals are using safety engineered needles. There are two categories of safety engineered devices. First is user activated safety devices and the second one is passive safety devices. A user activated devices requires healthcare workers to activate a safety mechanism and cover the shaft themselves. And a passive safety device features a design that automatically covers the shafts after use. Here are some examples of user-activated safety devices. Needle recapper. If needed, we can recap the needle securely by using one hand with the use of this needle recapper. Next is Vacutainer needle holder. This provides a simple, effective way to collect blood and reduce the possibility of needle stick injury. Next is Eclipse safety needles with syringe. It allows for shielding the needle tip immediately after giving injection with single finger stroke. Here are some examples of passive safety devices. First, the needles that retract into a syringe. This needles automatically retracts when the injection is completed. Next is self-sheathing safety needles. A shield that slides over the needle and lock in place when the injection is completed. And the third one is the lancet needles. The benefits of these three type of needles: it reduces needle stick injury, prevents reuse of needles, reduce cross contamination and facilitate safe disposal. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.